The Healthy Michigan Plan is an expansion of Medicaid under the Affordable Care Act designed to improve the health and well-being of Michigan residents by extending health care coverage to low-income adults, many of whom were uninsured before gaining this coverage. The Institute for Healthcare Policy and Innovation at the University of Michigan was chosen by the Michigan Department of Health and Human Services, or MDHHS, to help answer a number of important questions like, is it reducing the amount of uncompensated care provided by Michigan hospitals? Do enrollees and providers feel it has had a positive impact? And is it improving health outcomes and healthy behaviors? IHPI has brought together faculty from across the university to evaluate the Healthy Michigan Plan and report their findings. And while the team's work is due to run through 2020, they've already been busy surveying more than 2,000 primary care providers on their experiences and approaches in caring for Healthy Michigan Plan patients, conducting a telephone survey of more than 5,000 people currently or previously enrolled in the program to get their perspectives, and reporting on uncompensated care provided by Michigan hospitals and how it affects insurance premium rates. IHPI is continuing to evaluate the impact of the Healthy Michigan Plan and sharing insights and lessons learned with MDHHS and the Federal Centers for Medicare and Medicaid Services, or CMS. To learn more about IHPI and its work with the Healthy Michigan Plan, take a closer look at our website, ihpi.umich.edu.